What is the best procedure for my cheekbones? I have an odd cheek shape, kind of flat-faced, going in then out from my eye, rather than out and in. I would like to add volume into my cheeks, something subtle. However, I don't want to look plastic or stretched. Maybe filler? Would Voluma work? My face is pictured on the left, desired natural result on the right.
Thank you for your question. You've submitted two photos, and in your question you describe a situation where you describe your facial structure as being a little bit odd and referring to some flatness in areas around your cheek. And you're asking about the benefit of potential filler and specifically Voluma. So I certainly can give you some guidance with this question. This is the type of question that comes up in my practice every day. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and augmenting the cheekbones to help particularly enhance the whole shape of the face and particularly the area around the eyes is a very popular procedure in our practice. And I want to also address the question about the approach, and you asked about a specific name brand called Juvederm Voluma. And part of the reason why you probably are thinking of Juvederm Voluma is that the company Allergan got the FDA approval for mid-facial augmentation with this filler. And I can tell you a little bit more about how we use it, because one thing that I always try to emphasize in educating people about injectable fillers is that companies promote the use of their product, and the product almost becomes a concept that people feel is equivalent between practitioners. And I try to differentiate for my patients and for people who are interested in learning that the product is still a tool for a practitioner to accomplish a specific outcome. Very often, just like there's a positive association with a product, sometimes there's a negative association. People will say things like, I tried Voluma, but it didn't work for me. Well, I always tell them, well, yes, that might be possible, but it could be also the way the Voluma was placed or the amount that was placed can be also an issue that led to an unsatisfactory result. So in our practice, we do something called structural volumizing, and I think this is very much in line with the concerns you have, because what you're describing is essentially a genetic volume deficiency of an area around the eye and around on the cheekbone. So what differentiates structural volumizing from traditional filling is that structural volumizing, we're placing the filler at the bone level. And it's done in what I feel is a very elegant approach, using different methods that minimize bruising, minimize swelling, and minimize trauma. And generally speaking, many doctors who use injectable fillers place fillers using a needle and directly into a soft tissue compartment. Certainly that's the most popular approach, but what I find is often the case is that either too small a volume is used so you don't get the best volume correction, or the other side, which people always notice, is too much volume is placed and the soft tissue becomes too rounded or it becomes too heavy. With structural volumizing, it's being placed on the bone structure, and we're able to really get these beautiful cheekbone definition. This is not promoting the procedure itself, but it's giving you the guidance as to the differentiation on how a filler such as Voluma can be used in different areas. One of the advantages I feel specifically about Juvederm Voluma, since you asked about it, is that the material is actually designed in a way that gives it more body and more viscosity, which gives it more strength when you place it, and it tends to absorb less water as other hyaluronic acid fillers do. When there is less water absorbed, there's actually less swelling. So that itself is also a great advantage of the product. But remember, you want to differentiate the product from the practitioner. So I would recommend you find and look for a physician that you would feel comfortable with trying this product or other products, depending on what the physician feels they're most comfortable with. Learn about your options. Think about what kind of outcome would be satisfactory to you, and then take the plunge. Try and see if you like the results. So I hope that was helpful. I wish you the best of luck, and thank you for your question.